topic will be functions of ovarian hormones, specifically estradiol and progesterone. So the estradiol and the progesterone are the main hormones of the female reproductive system that are synthesized inside of the ovaries presented here and inside of granulosa cells and tetracells. I will begin with explaining the hypothalamus hypothesis portal system and its hormonal regulation. So the gonadotropin-releasing hormone is secreted by hypothalamus, and through the portal system it appears in adenohypophysis, where adenohypophysis secretes LH, luteinizing hormone, and FSH, follicular-stimulating hormone. Respectively, these two hormones are stimulating the ovaries, the granulosa cells, and tetracells. But what happens here? The LH, the granulosa cells, has receptors of two of them, LH and FSH. And tetracells have only receptors for LH. So in the first part of our uterine cycle, or it's also called endometrial cycle, in the female reproductive organs, most of the hormones, the female hormones, are androgens. So the prosecutors are testosterone, actually. And most of them are through the granulosa cells with the help of the enzyme aromatase are converted into the estrogens. And it's the most potent one is 17-beta estradiol. And then the 17-beta estradiol causes the proliferation and the growth of the tissue. And it's also, this phase is called follicular phase, because this is where we are developing the follicle, the Graafian follicle. So this stage goes from about 1 to 13 days, some books 1 to 12 days, and this is where estrogen is up, estradiol is up, and it causes the proliferation and the growth of the follicle cell. And this mechanism, firstly, is controlled by the negative feedback. More of the estrogen, less of FSH and LH. But then something amazing happens. That there is something that's called ovulatory surge, and estrogen stimulates the shoot out of the LH hormone. It's 8 times more than FSH hormone shoots out, and this is what we call ovulation, which just causes the eruption of the follicle and the oocyte release, and for the further fertilization. But then if the fertilization doesn't appear, then we have the progesterone comes into the place, and it's secreted by the corpus luteum mostly. And the progesterone starts its formation and the generation of the corpus luteum if there is no fertilization appeared. And if it's fertilization appears, we continue to the development of the fetus. So the main function of the progesterone here mostly is the preparation of the uterus walls for the implantation of the oocyte. But what happens if the implantation doesn't happen? And what happens next? So the corpus luteum starts degenerating, but the buildup of the uterus wall and lack of the hormones causes the endometrial glands to secrete more in the blood vessels, and eventually necrosis and the separation of almost 65% of its cells. And then we have menstruation, which appears on the day 28. Which stage? Yes, approximately. Yes. The days of the gap, well, the full menstrual cycle, some people are 28 days, some could be 31 days. If there is more or less than that, this is considered to be a
28 plus 7 or minus 7? That is the rate.
Yes,
Plus 7, for some people it may be 28 plus 7. So it will be like literally 42 days.
Yes, that's
what minus 7? What about 21st day itself? Can you have?
If there is a 21st days, it could be like the symptoms of ovulation, for example, and there is a lack of the hormones and mostly progesterone. So yes, yes.
28 minus 7, 28 minus 7. The same thing goes for secreted to make them?
It's estradiol, estriol, and the potency is by estradiol the most potent, and estrone and estrone. Yes.